So I'm Katie Adams. I'm the Director of Addiction Services for Southwestern Behavioral Health Care. And Southwestern is a community mental health center in Indiana. There's one of 25. We are one of 25 in Indiana. And as a community mental health center, our mission is to care for those in our communities that have a mental illness or an addiction problem. And our goal is to provide quality services to them and to help them to recover. Stepping Stone is the name of our addictions facility for Southwestern Behavioral Health Care. And at Stepping Stone, we have the full continuum of care, which includes detox, residential, transitional residential, and outpatient services, so that individuals that need help with addiction can get all the services that they need under one roof. Well, we have a wonderful recovery community here in Evansville, and that recovery community includes different types of groups depending on what people feel that they fit into best. And that includes Narcotics Anonymous, NA, Alcoholics Anonymous, which is AA, and we also have some Christian groups called Celebrate Recovery or Accent on Christ. But all of these are support groups that are free to anyone who would like to attend, who identifies themselves as having a problem with addiction, and they're free. And there's 170 or so a week in our community, so pretty much any time of day of the week, you can find a connection to people in recovery. If you are aware of somebody who has a problem with addiction, or if, let's say, your son or your family member is struggling with addiction, there's a few things that you can do. Getting back to just the recovery support that we have in our community, there is a free support group called Al-Anon, and also Families Anonymous. And both of those are support groups that anybody can go to in our community to be around people who are struggling with the same things, to gain support, to get ideas, and to attend those programs and go through the steps like someone would if they had an addiction problem. The other option is that you can get treatment for yourself. And here at Stepping Stone, we have a program called CRAFT. And that program is treatment for the loved one who has a husband who is drinking or a daughter that's using drugs and won't get help themselves. And the idea is that even though your loved one is not getting treatment, you can get treatment yourself to learn ways to interact with them to hopefully help them engage in treatment. So people come to treatment for different reasons. And sometimes they come on their own because they've just decided that they've had enough. Sometimes it's a family member that's threatened to leave them. Sometimes it's the court. Sometimes it's child services taking their children away. And often that first step is very difficult, that first step of walking into the doors of treatment and asking for that help. And there's a lot of questions that people have and fears that people have about what is treatment really like. And often that's a barrier to treatment, just that fear of does it look like. And so what we'd like to show is what that is like, what our admission process is like, and what treatment is like. So when you're admitted to the residential program, you first present with your belongings to our technician station, where you first have a breathalyzer completed. And then you move on to our nurse's station, where our nurse does a medical screening to make sure that there aren't any underlying medical issues that we need to treat first. And that includes having your vital signs taken, which includes your blood pressure, your pulse, respiration, and your temperature. And she'll also give a brief screening of asking you about your medical history and reviewing any medications that you bring. So after meeting with the nurse, the next step is to complete some necessary paperwork, which includes signing a consent to treat and some releases of information that gets us permission to talk with family or your referral source about your treatment. After you've completed your paperwork, then we bring you to your room. We search your belongings to make sure that you have brought all the necessary things. And what you should bring include clothing for about a week, your toiletries, quarters for laundry, and any other personal hygiene items that you would need. You may not bring cell phones, reading material that's not recovery-based, food, linens or pillows, anything with alcohol in it or aerosol cans, and any controlled medications. After admission to your room, you're given a tour of Stepping Stone and the program here. You're given a folder and the guidelines so that you'll know where to go and what the schedule is. And you'll start treatment right away, which includes classes, individual group therapy, outside 12-step meetings, as well as meetings in our facility. Our daily schedule is very busy. People wake up around 6:30 in the morning and have classes and groups all day long until about 9:30 at night. Length of treatment here at Stepping Stone is somewhere between 21 and 28 days.
I wake up every day in a good mood. I wake up not worrying about going to jail or worrying about where I'm going to get this or that drug.
I have goals and ambitions again. Everything has gotten better with relationships. Life is so much better today than I thought it would be.
Take your first step today.